Hi guys, my name is Maryke. I'm the physiotherapist from sportsinjuryphysio.com, where you can get online physiotherapy treatment. Good, so tonight's topic is all about plantar fasciitis, and I'm going to discuss first of all how you know that you've got plantar fasciitis. Then we're going to look at things that you need to exclude because certain conditions can actually feel very similar. Then I'll discuss how the plantar fascia actually looks and what it does so that you can understand why you get an injury to it. And then I'll also run through all the different things that can cause injuries to the plantar fascia. And then lastly, I've got a list of 10 different types of treatment that I'm going to discuss. Some of them work really well and others are a little bit more variable, but we'll get to that later. Good, so how do you know that you've got plantar fasciitis? Now, the first thing is that you have usually got pain on your heel. And I'm going to show my lovely clean foot if I can get it up there. So that's your heel, inside of the foot. And the pain from plantar fasciitis is usually at its worst around this area. Now, it can feel as if it involves most of the heel as well, but that's where you get your point pressure with the pain from it. Very often, it's that first thing in the morning when you get out of bed and those first few steps you give can be really stiff and painful. If it's in the beginning stages, you may be able to warm it up, and as the day goes on, it feels fine, but then first thing in the morning, it's bad again. When it's really bad or really flared up, it may be that the pain stays with you throughout the whole day and it's really difficult to walk. Some people find that it can hurt at the beginning of a walk, and as they go on, it warms up, but then the pain increases afterwards again. Others find that as they're walking, the pain gets worse and worse, and they eventually have to stop. And standing is often just as bad as walking. In some cases, you may think that your foot is all fine, and then if you sit still for for about an hour or half an hour or something and get going, it's as if you've been sleeping at night again. That those first few steps can be quite painful. So that is usually when you can start thinking that you may have plantar fasciitis. Now, there are other conditions that can feel very similar, and it's all about how this pain starts that can help your clinician decide whether it is that or not. So one of the key other things is if you've bruised your heel or your fat pad. So again, my lovely foot, in this area, we've actually got a nice fat pad that's you find between the bone and the skin for obvious reasons, because you've put a lot of force through that heel, so it protects that heel. Now, if you've stepped on a sharp stone or on anything sharp on the floor and had an instant pain there, that fat pad can feel very similar to, or the bruising in the fat pad can feel very similar to plantar fasciitis. So if that is how your pain started, then your injury is not plantar fasciitis, it's bruising of that area of your foot. And what you need to do is really cushion it for a while so that it can recover. Second one is you can actually sprain or tear your plantar fascia. So how you know you've sprained or torn something is if the pain comes on at a sudden sharp pain. For instance, if you're running up a hill and you suddenly feel a sharp pain under your foot, then chances are you may actually have given it a little tear. And that type of injury needs a different type of treatment from plantar fasciitis, because if you look after it very well for the first few weeks and offload it, you can actually improve your recovery rate with that. Then also some people mistake pain in the Achilles tendon insertion or even pain in your other tendons that comes around the foot for plantar fasciitis. Yes, so if you think of the Achilles attaches in there, if your pain is more on this bit of the foot, that's not plantar fasciitis. Also, if the pain is more on the inside there along the ankle, again, that's not plantar fasciitis. That's more your post tendinopathy, and there's also a little nerve that runs there. Also, depending on your demographic, it could be osteoporosis in the heel. Now, don't get paranoid about osteoporosis. It's a very rare thing, and it's usually just if you have a family history of osteoporosis, or if you're female and have gone through the menopause, or have had other issues with your weight or things maybe when you were younger, that could be a factor. But it's not the first thing that I would suspect. I would definitely in somebody where the pain drags on and doesn't react to things, and they fall into the category of possibly having bone density issues, that's something that I would refer them for to have checked. But I've only ever found that in a couple of elderly patients that I had. Now, one not to miss is nerve pain. So pain from your lower back, or even just pain from the nerves in your leg, can also refer pain into that area. So your sciatic nerve runs down the back of your leg. You've got, I've nearly forgotten the nerve's name now. I think it's your tibial nerve that comes around the inside of your foot and your tarsal tunnel. I see Glenn's watching. Maybe he can help me out here. But there are quite a few small nerves that can refer pain into that area. And it's quite an easy test that your clinician can do with you, getting you to do the slump test or the straight leg raise test and seeing how that influences your foot pain can tell you whether it's the nerve or plantar fasciitis. I know somebody in the group mentioned that they've got glute pain on that side, and I can't remember what else, but then also Achilles pain or plantar fascia pain on that same side. Now, if a patient comes to me with pain around the lower back and especially pain in the glute in that same leg, I would have a high suspicion of the nerve causing the pain. But of course, you've got to do the tests and things and see if it is that or not. Let me just see what questions are coming in. Hi, Tracy. Glad you're watching. Okay, cool. Good. So to recap, plantar fasciitis is pain on the inside of the heel, and it's usually bad for the first few steps in the morning, or if you've sat still for a long period of time. It doesn't like you standing on it for long periods of time. Be careful not to mistake it for with if you've bruised your heel, or if it's actually nerve pain, or any of the other things that I've just mentioned. And I've forgotten that I actually have a cool slide about that. So if you've missed that, it could be a fat pad that you bruised on your heel. It could be a strain or a tear in the plantar fascia as well, or the Achilles tendon that's sore. Osteoporosis is not the most common cause, but if you're elderly female and there's a family history of osteoporosis and the pain persists, that may be something that I would want to rule out. And then lastly, nerve pain. Okay, so how does the plantar fascia actually work and what does it look like? This is a picture of somebody's foot from underneath, and they've cut the layer of skin off it. So you can see that white stuff, which way am I pointing? That runs, that thick fascia band or sinewy band that runs from the heel and to every single toe. That's the plantar fascia, and it's made of that thick stuff, the same as, you know, when you cut meat and there's that thick white stuff that you can't chew and you don't really want it in your meat. That's the same type of material it's made of. Now, it's got to be that strong because it forms a very important part of the support network of the foot. But let me just show you again, because I've got another picture here. This picture shows with the skin on where the plantar fascia runs, and you can see that I've actually drawn on my own foot there, and where I've made that red circle there is where you feel the pain when you have plantar fasciitis, or the main pain. Of course, it can spread a little bit as well. So going back to the picture of the ligaments or the plantar fascia, its job is to stop your foot from collapsing. Now, the foot has quite a good support network. The ligaments between the little bones, as well as the muscles, as well as the plantar fascia, supports your foot as you put your weight through it. Now, you can imagine the harder the floor is you walk on, the more the force through the foot is. Also, the less flexible your shoes are, the harder the force is. If you run versus walk, the more force goes through that plantar fascia. And what happens is, if the strain is too much, you strain it right there where it attaches to the heel bone, and that's why you develop your pain. Now, various reasons why the force may be too much for your plantar fascia. One of the most common causes I see is if people wear unsupportive shoes and they walk on hard surfaces, especially for long periods of time. So if you think of commuting through London and you've got shoes on that doesn't give you any cushioning and it doesn't support that arch, your foot is going to have to, or plantar fascia is going to have to work really hard to keep your arch's shape and form. If you're used to that, or you've got a really stiff foot, you know, some people have high arches that's really stiff. They are usually a little bit more protected against this condition. But if your foot's not used to the type of shoe you've put it in, or the period of time you're spending there, then that can cause an overload on the plantar fascia. If you're used to running a certain distance and you suddenly up your mileage, especially if you do a lot of more downhill running that will put a lot of force through your foot, that could be enough to overstrain the plantar fascia. If you pick up a lot of weight and then have to stand for long periods or go walking for a long distance, that can cause more strain on the plantar fascia than what it's happy with. What have I left out? Let me just see what other causes I've listed here. Tight calves is one of the things they name in the research, but to be honest, I don't find that as the major cause. Some people, yes, but not very often. I find that often the calf tightens up because of the pain from the heel as well. Then muscle weakness in other parts of the body. So if we think of the foot specifically, if the foot muscles aren't strong, plantar fascia is going to have to take a lot more strain. But also the rest of the muscles in the leg is meant to absorb some of the force when you run and walk. And if they aren't strong, the foot may have to take more force than what it wants. I don't know if you remember in previous videos, I've shown you about hip stability, and I wonder if I can show you that quickly. I'm going to bring this down a bit. So remember that test that you can do when you're on one leg and see where your knee moves when you do a single leg squat. Now, if the knee moves in more, it forces the foot in as well and allows it to pronate more, and that can actually cause more strain through the plantar fascia as well. So stability around the hip and strength in the rest of the body is quite important. And that leads nicely into the treatments for plantar fascia. Now, let me not forget, I've got a slide about that. By far, the most effective part of the treatment that I prescribe in my clinic is getting people to wear supportive shoes. Now, sometimes it means that I put an orthotic in. Orthotic is just support that you put into the shoe that supports the arch. Actually, if you hold on a minute, I'll go grab mine and you'll see what I mean. Now, you've got to picture this. Plantar fascia runs underneath the foot, stops the foot from collapsing. So anything that helps to support that arch will also act like a crutch for the plantar fascia and support it. So these are what one type of orthotic. You can see mine's a bit worn. And what it has is it's got this lovely arch where my foot sits in, and as my foot muscles get tired, this will help to support it. Some people just need proper shoes with a little bit of support on the inside, because most shoes has a little bit of this type of support built in these days, or that lace up. A definite no-no is anything like flip-flops, sandals, plimsolls, anything with a really thin sole that's quite floppy, that doesn't support the foot or doesn't give any support for the arch. And they are often the shoes that cause the pain in the first place as well. So you cannot expect your plantar fascia to get better if you're going to walk around in shoes that doesn't support it and allows it to keep on straining. I normally tell my patients to test all your shoes and find the pair that's the most comfortable, and then you live in that. And if you don't have a pair that's comfortable and you don't have trainers, I would often send them out to go buy a cheap but supportive pair of trainers with a nice thick sole that gives them quite a bit of shock absorption as well. And often, as soon as they get a shoe, quite often with a softish orthotic, their pain already starts to reduce. Now, with regards to orthotics, I just want to say that be careful for too rigid and solid ones, because often that pressure under the heel can be quite painful if it's too rock solid. So especially if you've got a flatter foot, a slightly softer orthotic that has a little bit of give can be the better option. Some people find those gel pads for the heels really good. but they don't really give a lot of arch support, those guys. So I would always go and try the arch support first. And if that doesn't work, go for the gel one. Because I definitely have patients where they found just the gel works best for them. Let me just see what questions are coming in there. So Jane's asking if this can affect the shins and pain in the front of the leg. Plantar fasciitis don't cause pain in the shins really, or pain in the front of the leg. If you're having that and you're having heel pain, then I would look for a different cause to your pain. It may be that you've got two conditions, depending on what sport or whatever you've done to annoy that area. You can definitely have, especially if you've done a long race, downhill racing and things like that, you can have two different things in a leg angry with you, but usually plantar fasciitis doesn't cause pain at the front of the leg. Good, so that's what I would say about shoes and orthotics. That's definitely the first thing you've got to sort out. Then with regards to stretches, yes, stretches can be very useful. Be careful not to overstretch your plantar fascia itself if it's really painful. I usually get my patients to first stretch their glutes and their hamstrings and their calves, and then once we've calmed the plantar fascia down a little bit, I add in stretches where you bend the toes back a little bit as well to get the plantar fascia more. But if you're going to jump right into really strong stretches on that, you may actually flare it up. So you've got to be careful when you do that. What I'll do is I'll post a blog post in the group tomorrow where you can have a link to all the stretches and all the self-massage techniques that I give my patients to do for this condition. Now, the reason you've got to do everything from the glutes down is because everything is connected. If you focus just on the plantar fascia, remember the plantar fascia is overstrained. So something else has not done its job properly. So it doesn't help to just go stretch the living daylights out of your poor foot. You've got to loosen everything along the back of the line. Okay, and that goes with massage as well, and the research has actually backed this up. It's shown that massage can be really useful for the pain from plantar fasciitis, but it works best if the massage also includes the gluteals, the hamstrings, and the calves, not just under the foot for the plantar fascia. And again, it's because it loosens that whole line, but my personal opinion is also it changes the pain along the whole line of the nervous system of the back of the leg. And we know that pain is always affects the nervous system. So if you can calm it all down, and massage and stretching is a good way of doing that, then you'll get a better effect than just hammering on the poor foot. One of the most favorite things that my patients find is useful is massage under the foot with a bottle of cold ice water. So they just take a normal bottle of water and pop it in the freezer and then do some massage on that. Now remember, that type of thing's not going to actually fix your plantar fascia. To fix the plantar fasciitis, you've got to offload it and give it a little bit of rest. That's where the shoes and orthotics and modification and what you do day to day comes in. But the stretching and massage can help with the pain modulation. I have just realized that I may have left one of the most important points off this list. Because together with shoes and orthotics, changing what my patients do in the day is the other really important thing. You have to manage the load you put through that plantar fascia. So I often tell people, if you don't have to stand, sit. If you don't have to walk, take your car or your bike. This is the time that you need to save that poor foot that the plantar fascia can start to recover. If yours is hurting with running, you've got to limit it to the distance where you can run without aggravating it. This is not the type of condition that you can run with and it's going to get better. It will likely just get worse. So you've got to respect it. It doesn't mean that you can't run. You've just got to find that sweet spot where you can run to where it doesn't cause you pain afterwards. Otherwise, you won't recover while you carry on with it. So the main things, if you think about load through the plantar fascia, is if you don't have to stand, sit. If you don't have to walk somewhere, take the bus, take a car, bike, but try and not be on your feet all the time. It's a good time to do some cross training. Rather go swimming or cycling than running, for instance. Okay, then that brings us to strength training. And for strength training for the plantar fascia, yes, there was an article that came out that showed that you've got to do fancy heel raises with a towel under your toes to strain that plantar fascia more. But to be honest, their results didn't show a massive increase in how quickly people recovered. And what I find in practice is those type of exercises works, but usually later down the line, once people have recovered a little bit, so that the plantar fascia isn't that sensitive anymore. So what I normally do is I prescribe strengthening exercises for the glutes and the hamstrings and the calf muscles first, and make sure that especially the stability muscles around the hip is really strong, that my patients aren't putting extra force through their feet just because this bit is weak. And if you think of it, if you're getting frustrated because you can't run at the moment because your plantar fascia is sore, then it's a very good time to do some strength training and feel that you're actually doing stuff to help yourself forwards. Okay, so make sure you include strength training not just for the foot, but also for your calf, your hamstrings, and your glutes. And to be honest, even for your quads, because they've got to produce quite a bit of the force when you run. So it's a good idea to make sure that they're strong enough as well. Then we get to the more passive types of treatments. So something we use in clinic in Eastbourne is laser therapy. And the low-level laser can be quite good for things like ligament injuries, tendon injuries. The plantar fascia is a similar type of substance or tissue to that, and it does work for that. But I find that it's kind of like a nice extra add-on. It's not the thing that's definitely going to fix your plantar fasciitis. The other things, the shoes, the orthotics, the offloading, and managing your sport is by far more important. Same for dry needling. Dry needling of the calves and hamstrings and glutes can help my patients regain their flexibility a lot quicker, but it's not going to change the healing process necessarily of that plantar fascia. But it's a very nice adjunct to make people feel more comfortable more quickly. Taping techniques. Now, one of the articles that I'll post in the group tomorrow has a low dye taping technique that supports your foot. And it uses quite a lot of tape, and somebody on YouTube also said that they really can't see how that's going to be comfortable in a shoe. Now, it's not a taping technique that I would use on a day-to-day basis, but what I found is for my patients where they're in a lot of pain and the orthotics aren't helping, the shoes aren't helping, they need that bit of extra support, taping the foot up in that really supportive way can make a big difference. And often after they've done that for 3 or 4 days, then they can actually get on with the other things. So it's not something that I would do every day, but if you know you're going to have to be on your feet, it can be a good adjunct to everything else. Night splints. So the idea behind a night splint is that there's a school of thought that when you sleep at night, the plantar fascia and your foot kind of drops, and the little cells shorten a little bit, and that first step that you put down on the floor causes them to stretch really quickly, and that's why you create more pain and more injury again. So what a night splint aims to do is keep your foot in that dorsiflex position, that you don't get the shortening. Whether it really works that way, I don't know, but definitely for some of my patients who's got persistent plantar fasciitis and is really struggling with first thing in the morning, night splints can make a big difference. And they can be divided into 2 groups. You can either get rigid night splints, that's like an ankle brace nearly, but it's a little bit, it's nearly like one of those boots they put you in when you break your ankle. And then you also get a Strasbourg sock, which is literally something like a football sock, but it has a string that runs from the toes. Where's my foot? From the toes to the knee that keeps the foot in that position. And that's the one that my patients find a little bit more comfortable to sleep with because it's not so cumbersome as the rigid ones. Give it a go. If you're really struggling with your plantar fasciitis and it doesn't want to ease up, it's definitely worth giving it a go there. Now I've left weight loss for the last because weight loss is not something that happens overnight. But if you've gained a lot of weight or you are heavier than what you should be, losing weight will decrease the force through your plantar fascia and can be the thing that actually changes or makes the biggest difference. It can be hard when you're injured to actually find something that you can do to help you with weight loss. But there are other options. There are options. You can go swimming, you can go cycling, find something that doesn't cause you pain. But unfortunately, if you are heavy and overweight, losing the weight will make a difference. Okay, let me just see what other questions I've had coming in. Oh, Tracy, I'm glad you're finding the advice helpful about the stretches. Okay, so to round it all up, the most important thing, if I have to choose my top 3 things that I tell people to do to help their plantar fasciitis, is number 1, shoes and orthotics. I'm grouping them together because they need that support. Okay, think of it as a crutch for your plantar fascia to stop it from overstraining. Then second is load management, which I didn't put on the list, and I can't believe it's out there. But you have to modify your activity. If you're stubbornly trying to run through it, it's just going to get worse. It's not going to calm down. You've got to find that sweet spot that you can do that doesn't cause it to flare up. Then look at what you're doing in the rest of your life. So remember, if you don't have to stand, sit. If you don't have to walk somewhere, take your bike, take a car, or take the bus. This is definitely one of those occasions where it is worth doing that for a few weeks. And then of the other things, I would say stretching is probably the one that I like most. And remember, that's stretching of all the body parts, so the glutes, the hamstrings, and the calves. That can give your most instant relief of pain if you're struggling with it. But then for the long run, you've also got to strengthen up and make sure that it's not a lack of muscle strength that's contributing to yours. But the key point is finding out what caused yours so that you can figure out the right recipe for it. So remember, if you're struggling with it and you're not quite getting there on your own, you're welcome to consult me. I do Skype consultations, and I've put a link to the website where you can read more about this in the description of this video. Cool, so if you're watching this on a replay, let me know if you've got any questions and I'll answer them in the comments. Take care. Thank you for watching. If you would like to learn more about preventing sports injuries, make sure you hit the subscribe button. See you next time.